Hello there and welcome to this special ZBC Current Affairs program where we give you updates regarding the coronavirus. We'll be doing that from the Zimbabwean perspective as well as the global perspective. And of course, when we talk of what's happening globally, we do have Zimbabweans who are abroad who have had a brush with the coronavirus. And on the program this evening, I'm joined by Leopold Chakanyuka, who is a Zimbabwean student and is resident in Wuhan in China. Remember, Wuhan was at one point the epicenter of the coronavirus. Leopold, it's a pleasure, my brother, to have you on the program.
Thank you so much, Justin.
Now, out of curiosity, and everyone would love to know, even people here back home, how did you manage to survive the coronavirus?
I think it was actually a combination of factors that made us survive, as you can see. Firstly, I would like to say, it was the seriousness upon which the government of China and the authorities took the matter. You realize when there was an outbreak of the coronavirus in Wuhan, the government was very, very quick into action. And they also there was actually a lockdown in Wuhan. As I'm speaking to you right now, I haven't been able to leave my apartment for more than 2 months now. So I think it was also one of the other factors that actually helped us to survive. Because by locking down the city, it prevented, the spread of the virus from the city to other cities, and also it limited the intra-city spread. Because, people were now locked in their apartments and no one could be allowed to leave their apartments. So it was really helpful and it helped us a lot.
2 months indoors, Leopold. What's life like to you there?
At first, I think people really didn't understand because it was the first time when we experienced such a thing. It was never heard before. So, the first times we were really worried and people were crying. We would receive calls, especially from other Zimbabweans who were here saying, we are away from our families, and they were so stressed. But then later on, we began to understand when we saw the virus spreading in other countries, in the other cities. We began to appreciate the Chinese authorities and all the measures that were put in place. And now we are now used to staying indoors. And now we know that it's also for our own benefits to stay indoors. So I think everyone now, we are happy to stay indoors. Even that we have also heard that the city will be opened on the 8th of April. But I'm sure after the experience we have been through, not so many people would want to, to just wander around, go to anywhere. They will actually have to leave their rooms when there is a need to go outside of their rooms.
Now, a lockdown that's for close to 2 months, and you've been staying indoors, living actually indoors. When you talk of the freedoms that are used to, what exactly was it that you would say you have been missing all these 2 months?
You know what? I think we lost almost everything to do about a free life. Because imagine when you are in a situation whereby you are in a foreign land and you can't even meet your friends who are in the next building. You can't even interact with people that are possibly across the road. You can't go out. People were used to going out for movies, people going out for shopping, people going out for a number of things. But then all of a sudden you become more like a prisoner. You are staying in your room. You have nowhere to go. You can't even meet some of your friends and so forth. So you missed almost our daily life. But then later on, like I said, we ended up appreciating. And we also, when there is need, you always find a way out of the situation. We ended up, especially for students, we used that time to read books, to write articles, to research on so many things. And it was also, good time for us and, generally as students.
And apart from the research and the writing that you are doing, how else do you pass time indoors, Leopold?
Sometimes, I think the reading is actually the most important thing, I would say, especially for students. And when you start reading, sometimes, you have, at least you have something that you are doing. You are adding value to your life as well. And then you can sometimes, communicate with your families. You communicate via phone. You can call them. You can chat with your families and your friends. Is also helpful. And watching movies as well. At least we can watch TVs and so forth. So we can also use that as to push up time and to kill time.
Now, when you first heard that there was that virus that had been detected in Wuhan, the very first time you heard of it, what came to your mind?
Okay, first time when I heard about the virus, I was actually not in China. I'd gone to Nepal. So on my way back to Nepal, I had my friends from India. So they showed me a message saying, we have received messages that people shouldn't be going to Wuhan because there's a virus. And that was my first time to hear about it while I was outside of the country. And I was so worried. I was extremely worried. I had nothing to do. I couldn't go anywhere. I couldn't go back to Nepal. In that particular moment, I was at the airport. So I just had to come to Wuhan because that was that's my home. And I came all the way to Wuhan. And when I came here, the first thing I had to do was to research more about the virus. And I also, went to the school to get more information. And the school was very friendly, and they managed to give us, me personally, information about the virus, how to live, and so forth. And then 3 or 4 days after I arrived, then there was a lockdown. And then by then, I was quite aware of what exactly was happening in the city.
Uh, Leopold, when you look at your experiences there during the lockdown and prior to the lockdown, and perhaps what is happening here in Zimbabwe, what exactly would you say helped the people of China or Wuhan to quickly adapt to the lockdown and be safe?
First I would like to say, when the lockdown was put in, there was a lot of panic, and many people did not understand the reason why we had to be put under a lockdown. And people were really, worried, and they didn't even have food, they didn't have a lot of things. But because we quickly saw what was happening in the city, and that some people, our relatives, our friends, were getting sick, we realized that we actually had to respect the authorities and also protect ourselves. And after that, we then made sure that we would make sure we protect ourselves, and we just don't go out unnecessarily. And whenever we had to go out, we'd make sure that we wear protective clothes. And another thing also that I think kept us also strong was our daily lives, even within our apartments. We realized that this is the current situation that is there, and life should also, continue. And we started, adapting to a life of living indoors. We started watching, movies, started reading a lot of other things, and make sure that we also we chat with our friends, we interact with our friends through the phones. It also helped us, to remain calm and,
So as students, I understand, a lot of your daily normal activities were actually cut. Now, how did you adapt as students? Let's look at as Zimbabwean students in China, really. How did you manage? You needed money from home, needed support from home. How exactly did you cover that gap?
Yeah, I think it was really a tough situation, considering the fact that most of the people who are in Wuhan are students, and they rely on the money that is sent by their parents. And during that particular time, banks were closed. So there was no way we could go to a bank and get money, even if you had the money in the bank. But we would like to thank the president, because he heard our calls and our cries, and we had money that was sent to us, $100 each to every student in Wuhan. So that money also helped us in a bigger way. And also universities, they also started to provide the daily necessities. They also started providing food. And some other universities that were not providing food, they also started making sure that they arrange university authorities to go out into the shops and buy groceries for the students. So what you can do is you compile a list, you provide it to the school authorities. They would go out and they'll buy things for you. They'll bring things to you. And we also utilize online buying. So we sometimes buy things online, and then they bring the things to the campus. So I think these are some of the issues that have also helped us in it.
Now, Leo, let's talk about anxiety and stress related to coronavirus. Of course, many people the world over, out of fear, some would actually get sick, even when they are not actually sick. How did you manage those early stages of the anxiety that is associated with just hearing about this deadly virus?
Okay, I think firstly, the most important thing I would really say is to make sure that we are well informed. Because sometimes when you are well informed, you can make well informed decisions. We have a lot of people that are circulating fake messages, like fake news, and sometimes giving you fake advice. So sometimes if you don't really read through the message or you verify the message, sometimes you might end up, doing something that will endanger your life and also the lives of the people that are around you. If you also remember, there was a time when people would circulate messages saying blacks cannot contact coronavirus, young people cannot be affected by coronavirus, health people cannot be affected by coronavirus. These are some of the fake news that were circulating, and even some people went as far as suggesting that if you take lemons, if you eat garlic, if you eat these things, they will help you. So what is more important is when you receive most of this information, you have to verify. That's why we have trained people like medical doctors and nurses. Whenever we received that information, would make sure that you verify the information before you take action. You must verify the information. After verifying the information, then you know exactly what you are supposed to do. And then thirdly is to adapt to the new life. This is the current situation, and this is what is exactly is happening. And what we used to like going out is no longer the time to do that. So what we also need to do is now to try to do other things that will make our mind occupied, most of the times.
Leo, you mentioned the issue of the garlic, lemons, and so forth. Are they really useful? Are they helpful? Or what would you advise Zimbabweans here back home to do?
Okay, firstly, I would like to say I'm not a medical doctor, so I might not be really qualified to comment that much. But from what we were told and the information that we got was, the only way you can do if you have the virus is to seek professional help. Go to hospital. The doctors will treat you. The doctors will do whatever is the best to treat you. So we shouldn't be relying on some of this information, because at the end of the day, you might endanger your life thinking that you are doing things that are right. Wait and get advice from the professionals. Don't just do things because you have received a message from someone. Because we were told these are not part of the remedies that were recommended by the health professionals for us to take and to use in any day. So what we were encouraged to do, what we were advised to do was, whenever you feel that you are not feeling well, make sure that you seek medical advice.
Now, Jack Ma and the Alibaba Foundation have actually made a donation, huge donation of equipment, testing kits, masks, and so forth to Africa, also including Zimbabwe, of course. What's your comment regarding this gesture?
I think, this really tells you who really our friends are and which ones are not our friends. When you are in a situation that your Sawira is also possibly in a worse situation, but then your Sawira comes up and say, I know I am in this particular situation, but I always think about you. I think I should also be helping you. It tells you how China values Africa. It's clearly a sign that clearly shows us that, China, no matter what, will always be our all-weather friends. They are in the same situation, but they've remembered that we have friends who might not be able to get these things. So they took it upon themselves and say, we have to help our friends. We have to help those that we are always close to. So it's a sign that actually tries to show us that, China is always with us.
And now the concept of Ubuntu, Leopold, sometimes entails that we greet each other, we hug each other, we sit together with each other, we share our lives and our times and our resources as families, even including the extended family. What's your comment on that regarding this current pandemic that we are facing?
Yeah, you know what? There are so many ways of trying to show Ubuntu or to show Tsika or to show respect. Greeting is not the only way that we can show people that we respect them, we love them, we want them. Everyone right now knows that there is coronavirus. So everyone knows right now that shaking hands, we can transmit the virus. And the best way we have to do is you can still say makadi to someone without necessarily greeting that person, without coming close to that person. And you mentioned the issue of hugging. I don't think issue of hugging has always been part of our culture. We used to greet people, from a distance, and we can still maintain that. We can still clap here and say makadi to a relative and greet each other without necessarily shaking hands. Because if we say, because of our culture, we have to shake hands, then we are endangering ourselves, and which we would then regret instead of saying, instead of then blaming culture and so on. But we had to adapt to new ways of, greeting and say, because this is for the best of our society.
As we close, Leopold, what's your advice to Zimbabwe in the face of the coronavirus?
Okay, my advice to Zimbabwe is, I've been following news from Zimbabwe. I have heard what the president has said. I have seen the seriousness which the government is taking the matter. We heard yesterday that there was also a cabinet task force. So it's a sign that the government is really trying by all means to conscientize people, to make sure that people get to know about the coronavirus, and to try by all means to protect the people. So it is now upon the people themselves also to take an initiative. It's not supposed to be only the responsibility of the government to protect us, but we also have a responsibility as a people to protect ourselves and to protect those who are around us. So it's wise as it is right now for Zimbabweans to take advice as it is coming from the officials, to also verify whenever we receive message from WhatsApps and those other social media platforms, to make sure that before we take any action, let's always make sure that we verify that particular information and we are well informed. And lastly, the most also important thing is, whenever you feel that you are not feeling well, don't wait for the disease to become serious. Whenever you feel that you are not feeling well, the best way to do is to seek advice from the professionals. They will help you so that you can stay safe, you can protect yourself, you can protect your families.
That's powerful coming from you there, Leopold. Now, ndichakumbira kuti utaure mashoko iwayaya nemutauro wedu wechishona, zvauri kutaura mazano aungapa kuvanhu veZimbabwe kuti vangazvichengetedza sei kubva kuchirwere ichochi checoronavirus, nenhau dzekuti vangachengetedza sei mashoko avanogoverana pasocial media.
Chekutanga chandiri kutaura ndechekuti inini tikatarisa mutungamiriri wenyika nehurumende nezvavari kuita, kuti vari kuedza nepese pavanogona, mune zvatiri kuona panews, kuti vari kuedza nepese pavanogona kuti information igone kusvika kuvanhu, vanhu vagare vachiziva zviri kuitika maererano necoronavirus. Saka isu sevanhu tinofanira kuti tirambe tichiteerera, uyewo zvekare tichitsvaga information iri kuuya kubva kumaofficial sites ehurumende nevatauriri vehurumende, tichiteerera kubva kune zvavanenge vachitaura. Ndinoziva kuti ukada kuzvitarisa iko zvino kune information yakawandisa zvikurukuru iri kutenderedzwa pamasocial media, nekuti dzimweni dzenguva tikagoda kuitora information iyoyo inogona kutikanganisa isu igokanganisawo nehama dzedu. So chakakosha ndechekuti kana uchinge wawana information pasocial media, usangomhanya kutenderedza information iyoyo, nekuti uchaisa vanhu mupanic iri unnecessary. Uchaita kuti vamwe vanhu vafunge kuti vaakutorwara, kana kufungidza kuti vanhu vadye poison chaiyo vachifunga kuti vamwe vari kuzvirapa, ivo vari kutozvikuvadza. So chakakosha ndechekuti vanhu kana vachinge vawana information pasocial media, tanga veimaverifya. Kana muchikwanisa, endai even nepainternet kuti mugoogle muwane kuti information yandawana iyi ndeyechokwadi here. Kana zvichibvira, itofonai chaizvo even kuhurumende, kumaofficials akasiyana siyana, mofona mobvunza kuti izvi ndo zvatiri kuwana izvi ichokwadi here, musati maita. Nekuti dzimweni dzenguva tinopesa taakungodya magaliki, taakungodya malemoni, taakungodya zvinyi zvinyi, tichifunga kuti zvichatibatsira, but izvo zvisingatibatsire, zvichigona kunge zvichitotikuvadza neimwe nzira. Chekupedzisira ndechekuti ndinoti inini, kana munhu achinge arwara, make sure kuti iwewe waitsvaga rubatsiro kubva kuna ana mazvikokota. Nekuti tikangoti warwara ombomirira, kuti ukada kutarisa isusu takazvidzwa kakawanda stere kuti vanhu vanotaura iyo kuti flu chirwere chehuku. varume vaite varware nechirwere cheuku vabatire flu. Zvinhu zvoti tinogona kungozvitora tichiti nyamba iflu o chimwe chirwere chandiri kufunga kuti chirwere chiri simple, but pada uri kutozvikanganisa. So chirwere chawangowana, ziva kuti enda kunana mazvikokota unowana advice. Uyewo zvekare ndinoziva kuti ukada kutarisa nyika yedu yeZimbabwe, vanhu vazhinji iko zvino nekuda kwemamiriro akaita zvinhu vanogona kumanikidzwa kana kumanikidzirwa kuti vagone kubuda mudzimba vasaswere vari mudzimba nekuda kwezvikonzero zvakasiyana siyana. Kana munhu uchinge wabuda panze, nemadzidziro andakaita ndiri kuno ndekuti make sure iwewe kuti paunoenda panze wakapfeka mask yako zviri correct. Kana uchinge uchikosora usangokosorera pese pese, make sure kuti unozviprotectawo kana uchikosora, kuitira kuti kana iwewe ukanga uine virus wakuprotectawo mumwe wako ari panext pako. Kana uchinge wasangana nevanhu, tsika yedu yekuti ngatimhoresai nevakurutiradze tsika, I think for now ngatimboisai tsika iyoyo parutivi, tinzwisise kuti kumhoresana nekukudzana handi kungobatana ruoko chete. Tinogona kuratidza rukudzo kumunhu pasina kubata ruoko. Uyewo zvekare kana tichinge tawana mukana ngatimeke sure tageza maoko edu kana zvichibvira kune avo vanoafodha. Kufamba nezviendi sanitizer kuya kunongobatsira kuti paunenge wabata mubhazi, wabata panzvimbo dzakasiyana siyana, womeka sure kuti wachengetedza maoko ako, wamageza zvakanaka. Kana uchinge wadzokawo kumba, make sure kuti wazvichengetedza nekutsvagawo information, kuti ngatigarei nguva zhinji, noti kuti tiswere tiri paWhatsApp kutsvaga information tichiitenderedza inogona kunge iri yekunyepa, but ngatitsvagei information yechokwadi tigokwanisawo zvekare kunge tichiitenderedza igokwanisa kubatsira vanhu.
Well, tinotenda zvikuru Leopold Chakanyuka nekutora nguva. I know kuti wanga wakugadzirira kuti unozorora unorara nekuti nguva dzafamba ikoko kuno kuchakati chenei, asi toda kutenda zvikuru nekupa mukana kuchirongwa chino kuti tigokurukura newe semumwe akakwanisa kuona zvaiitika kuWuhan kwaugere uchidzidza pamusoro pechirwere checoronavirus. Thank you so much Leopold for having made time to discuss with us regarding this issue of the coronavirus.
Oh, thank you so much, Justin.
Right now, I'm joined by Tidi Kwidini, our ZBC UK correspondent, and she's going to be giving us an update of how the United Kingdom is managing the scourge of the coronavirus there. Tidi, you can go ahead with your update.
Okay. Hello, Justin. Yes, things are changing on the daily basis in the UK. Prime Minister Boris Johnson has clamped down on movement in the UK, enforcing stringent curbs on life to tackle the spread of coronavirus as the death toll has increased to 433. The Prime Minister said on Monday the measures were necessary to tackle the biggest threat the country has faced for decades. After days of being accused of sending mixed messages about what the public should do, Johnson escalated his message in his State of the Nation address, informing the public that the police will be ordered to impose a strict coronavirus lockdown with a ban on gatherings of more than 2 people and strict limits on exercise. He told the British public, "You must stay at home." He said people may only leave home to exercise once a day, to travel to and from work where absolutely necessary, to shop for essential items, and to fulfill any medical or care needs. Only key workers, that is people working in the National Health Service, supermarkets, and the security services, are allowed to leave the house. The government has also appealed for volunteers to help out during this period to assist with shopping for the vulnerable, delivering food and medicines, driving patients to appointments, and phoning the isolated. 11,000 former medical staff have agreed to return to the health service. They will be joined by 24,000 final year students and medics. Mr. Johnson said people should not be meeting friends. He said that if any friends ask to meet, that they should say no. He has also said that family members should not be meeting anyone outside of the house or people that they live with. He's also said that people should not be going shopping except for essential things like food and medicine. Businesses were ordered to close as part of the measures, and non-essential shops have also been closed. Retailers have joined pubs and restaurants in being told to shut their doors after a weekend during which many people were still out in their numbers despite government pleas to isolate themselves. There's controversy about allowing the construction industry to continue operating, although some of them have closed because they will not be able to maintain the government's guidelines about working 2 meters apart. It is also a challenge for a number of businesses who, in some instances, have had to let staff go. They have converted a building in London into a hospital to accommodate more patients in the coming weeks. Meanwhile, the Home Office has said that it is extending visas for foreign nationals who are unable to return home due to the pandemic. Leave will be extended to 31 May for individuals who are currently unable to return home at the end of their visas. Back to you in the studio.
Thank you for that update, Tilly. Quite a number of measures there that have been implemented by Prime Minister Boris Johnson of the UK to try and curb the spread of the coronavirus. And Tilly Quilini is our ZBC UK correspondent. For those at home who are watching this program, it's been a pleasure having you again. We will continue to be giving you updates regarding the coronavirus here on ZBC TV. I'm Justin Mahlatla. Have a pleasant viewing.